4 types of farts seniors must fear and why ignoring. These gas warning signs could be dangerous. Every year, over 40,000 seniors are hospitalized for what starts as simple gas they chose to ignore. If you're over 60 and noticing changes in your flatulence, this isn't just embarrassing. It could be your body's urgent warning system telling you something is seriously wrong. Most people dismiss gas as a normal part of aging, but certain types of flatulence are red flags for colon cancer, bowel obstructions, and life-threatening infections that progress silently. The difference between a harmless toot and a medical emergency often comes down to recognizing 4 specific patterns. What you're about to discover could literally save your life, because the gas you're experiencing right now might be screaming a warning you can't afford to miss. Your digestive system is trying to tell you something critical. Are you listening? In the next few minutes, I'm going to walk you through the 4 types of flatulence that demand immediate attention after age 60. You'll learn the exact warning signs doctors look for when diagnosing serious conditions, including a simple smell test that reveals what's happening inside your intestines. I'll show you how to distinguish between normal aging and dangerous symptoms, plus give you a checklist you can use today to evaluate your own digestive health. We'll cover when home remedies are safe and when you need to get to a doctor within 24 hours. But here's what might surprise you most. The 4th type of gas we'll discuss is the one physicians fear the most. Yet it's the one seniors are least likely to report because they don't realize it's connected to 5 different life-threatening conditions. By the end of this video, you'll have practical tracking methods, specific questions to ask your doctor, and dietary adjustments that work specifically for aging digestive systems. Stick around, because that final warning sign could be the difference between catching something early and facing a medical crisis. After 60, your digestive system undergoes fundamental changes that make gas patterns a crucial health indicator. Your stomach produces less acid, which means food doesn't break down as efficiently. The muscles in your intestinal walls weaken, slowing down the movement of waste through your colon. Your gut bacteria composition shifts dramatically, and certain beneficial microbes decline while others multiply. These aren't just minor inconveniences, they create the perfect conditions for serious problems to develop quietly. Here's what makes this critical. Decreased stomach acid allows harmful bacteria to thrive in places they shouldn't. Slower intestinal movement means toxins sit in your system longer, increasing fermentation and gas production. When your gut microbiome becomes imbalanced, it affects everything from nutrient absorption to immune function. This is why gastroenterologists pay close attention when seniors report changes in flatulence. It's often the first measurable sign of diverticulitis, inflammatory bowel disease, or even colorectal cancer. Your risk for bowel obstructions triples after age 65. Lactose intolerance worsens because your body produces 90% less lactase enzyme than it did at age 30. Medications you're likely taking, blood pressure pills, painkillers, calcium supplements, all alter your digestive chemistry and gas production. Physicians understand that what seems like a minor gas issue in younger people can signal major complications in older adults because your body has less reserve capacity to compensate. When your digestive system struggles, it doesn't whisper. It shouts through symptoms like unusual flatulence, and ignoring these shouts can cost you months of treatment time you can't afford to lose. Type number 1. The rotten egg smell. That unmistakable rotten egg odor comes from hydrogen sulfide gas, a compound produced when sulfur-containing proteins break down in your intestines. When you eat foods high in sulfur, eggs, meat, garlic, cruciferous vegetables like broccoli and cauliflower, bacteria in your colon metabolize these proteins and release this distinctive smell. In small amounts, this is completely normal digestion at work. But here's where it becomes dangerous for seniors. Persistent rotten egg gas that occurs regardless of what you eat signals bacterial overgrowth in your small intestine, a condition called SIBO. This happens when bacteria that belong in your colon migrate backward into your small intestine where they ferment food prematurely. SIBO affects up to 30% of people over 60 and can lead to severe malnutrition because these misplaced bacteria steal nutrients before your body absorbs them. You'll notice weight loss, chronic diarrhea, and intense abdominal cramping alongside the foul-smelling gas. This odour also points to parasitic infections, particularly Giardia, which seniors contract from contaminated water or food. If you've travelled recently or noticed the smell started after a restaurant meal, parasites could be colonising your digestive tract. The sulfur smell intensifies because parasites damage your intestinal lining, preventing proper digestion. Gastroparesis is another serious culprit. This is when your stomach empties too slowly, causing food to literally rot inside you before moving to your intestines. Diabetes causes gastroparesis in many seniors, and the condition creates dangerous blood sugar swings while producing that characteristic rotten egg stench. Medications like opioid painkillers and certain antidepressants slow your digestive system enough to trigger the same problem. Here's how to know if it's dangerous. Occasional rotten egg smell after a sulfur-rich meal is normal and should resolve within 24 hours. But if you're experiencing this odour 3 or more times per week, lasting several days at a time, or accompanied by unexplained fatigue and loose stools, you're dealing with something that needs medical evaluation. If the smell is so intense that it fills a room, or you can taste it in your mouth, that's an emergency sign of possible bowel perforation or severe infection. Pancreatic insufficiency also produces this smell because your pancreas isn't releasing enough enzymes to digest fats and proteins properly. The undigested food ferments excessively, creating overwhelming amounts of hydrogen sulfide. You'll notice your stools become greasy and float. That's undigested fat leaving your body. Type number 2. Excessive painful gas. Let's be clear about what excessive actually means in medical terms. Passing gas 14 to 23 times daily is considered normal for adults. Excessive means you're releasing gas more than 25 times per day, or you're experiencing such severe bloating that your abdomen visibly swells by 2 or more inches. The painful part is what separates routine discomfort from a medical crisis. We're talking about sharp stabbing sensations that make you double over, cramping that wakes you from sleep, or pressure so intense you can't stand upright. This type of gas often indicates a partial bowel obstruction, where something is blocking the normal flow through your intestines. In seniors, adhesions from previous surgeries create internal scar tissue that kinks your bowel like a twisted garden hose. Hernias can trap sections of intestine, causing gas to build up behind the blockage with nowhere to escape. Tumours, whether benign or cancerous, narrow the intestinal passage and create a backup of gas and stool. The pain intensifies because your intestinal muscles are contracting forcefully, trying to push contents past an obstruction that won't budge. Diverticulitis causes this painful gas when small pouches in your colon wall become inflamed and infected. These pouches, called diverticular, develop in 50% of people over 60 and 70% of those over 80. When they trap food particles and bacteria, infection sets in, creating intense gas pain concentrated in your lower left abdomen. The trapped gas can't move freely through the inflamed tissue, building pressure that feels like someone is inflating a balloon inside your gut. Volvulus is a life-threatening emergency where your intestine twists on itself, cutting off blood supply while trapping massive amounts of gas. This creates excruciating pain that comes in waves and causes your belly to become rock-hard and distended. Seniors with chronic constipation face higher volvulus risk because the weight of impacted stool causes the colon to rotate. Ischemic bowel disease reduces blood flow to your intestines, usually from clogged arteries, the same process that causes heart attacks, but happening in your gut. Without adequate blood supply, your intestinal tissue can't process food properly, leading to fermentation, excessive gas production, and severe cramping pain that typically strikes 15 to 30 minutes after eating. Here are the red flags demanding immediate medical attention. Pain so severe you can't complete a sentence. Fever above 101 degrees Celsius, accompanying the gas pain, vomiting that won't stop, inability to pass stool or gas for more than 12 hours, or abdominal rigidity where your belly feels board-like when touched. Blood in your stool, even small amounts, combined with painful gas, means tissue damage is occurring. Rapid heartbeat, dizziness, or cold sweats alongside gas pain signals your body is going into shock from infection or tissue death. If you're taking blood thinners and develop sudden painful gas with abdominal swelling, you could be bleeding internally. The combination of sharp pain in one specific spot that doesn't move, plus an inability to find any comfortable position, often means perforation. A hole has developed in your intestinal wall, spilling contents into your abdominal cavity. Type number 3. Sudden changes in frequency. Your body establishes a baseline gas pattern over years, and sudden deviations from that norm serve as an early warning system. If you've always passed gas 15 times daily and suddenly you're up to 40, or if you typically have regular flatulence but haven't passed gas in 2 days, your digestive system is signaling a significant change in how it's functioning. Dramatic increases in gas frequency often stem from carbohydrate malabsorption that develops with age. Your body stops producing enough enzymes to break down specific sugars, so they reach your colon undigested, where bacteria feast on them, creating excessive fermentation. Lactose intolerance intensifies after 60, as lactase enzyme production drops by 90%. Fructose malabsorption affects 40% of seniors, making fruits and honey suddenly problematic. But when this happens abruptly, within days or weeks rather than gradually, it can indicate celiac disease that's been dormant and suddenly activated. Or it may signal the early stages of diabetes, where your body's inability to regulate blood sugar is disrupting digestive enzyme production. Medications are frequent culprits behind sudden frequency changes. Metformin for diabetes causes excessive gas in 30% of users by altering gut bacteria and speeding up intestinal transit. Antibiotics wipe out your beneficial bacteria, allowing gas-producing strains to dominate. This effect can persist for months after you've finished the prescription. Fiber supplements like Metamucil, when started too quickly, overwhelm your system. Proton pump inhibitors for acid reflux reduce stomach acid so dramatically that food enters your intestines partially undigested, feeding bacterial overgrowth. Blood pressure medications, particularly calcium channel blockers, slow intestinal movement and increase fermentation time. A sudden decrease in gas frequency is equally concerning and often overlooked. This happens when your intestinal motility shuts down, a condition called ileus. Post-surgical ileus affects seniors recovering from any abdominal operation, but it can also occur from severe infections, electrolyte imbalances from dehydration, or as a side effect of narcotic pain medications. When your intestines stop moving, gas stops forming and passing. This silence is dangerous because it means nothing is moving through your system. Hypothyroidism slows your entire metabolism, including digestive function, leading to dramatically reduced gas alongside severe constipation, unexplained weight gain, and crushing fatigue. Scleroderma, an autoimmune disease that hardens connective tissue, can stiffen your intestinal walls, reducing their ability to contract and move gas through. Colon cancer frequently announces itself through altered gas patterns before any other symptoms appear. Tumours change the bacterial environment in your colon, either increasing gas through abnormal fermentation or decreasing it by blocking passage. When you notice your long-standing gas pattern has shifted dramatically within a month's time, especially if you're over 60 with no dietary changes, this warrants a colonoscopy. Gastroparesis from nerve damage, common in diabetics and those with Parkinson's disease, causes wild swings in gas frequency. You'll have days of excessive gas as food sits and ferments, followed by days of almost none as your stomach refuses to empty anything into your intestines. These fluctuations typically come with nausea, early fullness when eating, and unintentional weight loss that should never be ignored. Type number 4. Gas with additional symptoms. Gas accompanied by other symptoms transforms from a nuisance into a medical emergency because it indicates systemic disease affecting multiple body systems simultaneously. These combination symptoms are what gastroenterologists and oncologists watch for most carefully in patients over 60. Gas plus unintentional weight loss of 10 pounds or more within 3 months is the signature presentation of colorectal cancer. The tumour alters your gut bacteria composition, creating excessive gas, while simultaneously interfering with nutrient absorption and ramping up your metabolism as your body fights the cancer. This combination appears in 60% of colon cancer cases before diagnosis. Pancreatic cancer produces identical symptoms, persistent gas with progressive weight loss, because the tumour blocks digestive enzymes from reaching your intestines. When gas occurs alongside rectal bleeding or blood in your stool, you're looking at tissue damage somewhere in your gastrointestinal tract. Bright red blood indicates bleeding in your lower colon or rectum from polyps, hemorrhoids, or tumours. Dark, tarry stools mean bleeding higher up in your digestive system, possibly from ulcers, gastritis, or upper GI cancers. The gas results from blood breaking down in your intestines, feeding bacteria that produce excessive gas as they metabolize the blood proteins. Gas with fever above 100.4 degrees demi-calms signals infection that spread beyond your digestive tract. Diverticulitis with perforation allows intestinal bacteria to leak into your abdominal cavity, causing peritonitis, a life-threatening infection of the membrane lining your abdomen. Appendicitis in seniors often presents atypically with diffuse gas pain and low-grade fever rather than the classic right-sided pain. Cholecystitis, or gallbladder infection, creates upper abdominal gas pain with fever, nausea, and pain that radiates to your right shoulder blade. The combination of gas, bloating, and persistent changes in bowel habits, alternating between diarrhea and constipation, characterizes both inflammatory bowel disease and ovarian cancer in women. Ovarian tumours press on the intestines, creating gas and bloating that women often mistake for digestive issues. This cancer is called the silent killer because these vague symptoms are its only early warnings. Gas accompanied by jaundice, where your skin and eyes turn yellow, indicates bile duct obstruction from gallstones, pancreatic cancer, or liver disease. The blocked bile prevents proper fat digestion, causing excessive gas formation and greasy pale stools that float and smell particularly foul. When you experience gas with night sweats, chronic fatigue, and swollen lymph nodes, lymphoma affecting your abdominal organs could be the cause. The cancer disrupts normal digestive function while triggering systemic symptoms throughout your body. Gas plus difficulty swallowing, chronic heartburn, and persistent cough points to esophageal problems that cause you to swallow excessive air. But more importantly, it can indicate esophageal cancer or severe GERD causing Barrett's esophagus, a precancerous condition. The most dangerous combination is gas with sudden severe abdominal pain, rigid abdomen, rapid pulse, and shock symptoms like confusion or extreme weakness. This constellation indicates a surgical emergency. Perforated bowel, ruptured diverticulum, mesenteric ischemia, where intestinal tissue is dying from lack of blood flow, or ruptured abdominal aortic aneurysm. These combination symptoms matter most because isolated gas rarely kills anyone, but gas as part of a symptom complex indicates diseases that are immediately life-threatening or will become so without rapid intervention. Your body doesn't produce multiple severe symptoms without serious underlying pathology. Start keeping a gas diary using your smartphone or a simple notebook. Record the date, time, and approximate number of gas episodes each day. Note whether the gas is odourless, mildly unpleasant, or has that distinctive rotten egg smell we discussed. Document what you ate in the 6 hours before the gas occurred. This helps identify food triggers your doctor needs to know about. Track the location of any associated pain. Is it upper abdomen, lower left, lower right, or generalized? Rate pain intensity on a scale of 1 to 10. Write down how long episodes last, minutes, hours, or all day. Note what makes it better. Does walking help, lying down, taking antacids, or passing the gas itself? Ask yourself these critical questions daily. Has my typical bowel movement pattern changed? Am I going more or less frequently than my normal? Are my stools different in colour, consistency, or smell? Have I noticed any blood, even tiny amounts? Is my clothing fitting tighter around my waist from bloating? Am I waking up at night due to gas pain? Document your complete medication list, including over-the-counter drugs, vitamins and supplements with exact dosages. Many seniors take 8 or more medications, and interactions affect digestion profoundly. Record when you started each medication relative to when gas symptoms began. Measure your weight weekly at the same time of day. Unexplained loss of 5 pounds or more within a month needs documentation. Take a photo of your abdomen when it's most bloated versus normal. Visual evidence helps doctors assess severity. Before your appointment, write down all accompanying symptoms. Fatigue levels, appetite changes, nausea, fever episodes, or anything unusual. List questions you want answered. This preparation ensures you don't forget crucial details when you're nervous in the exam room, and it gives your doctor the complete picture needed for accurate diagnosis. Go to the emergency room right now if you experience gas pain with a fever of 101 degrees or higher, vomiting that prevents you from keeping down liquids for 12 hours, complete inability to pass gas or stool for 24 hours, or blood in your vomit or stool. Severe abdominal pain, rated 7 or above that doesn't improve within an hour, requires immediate evaluation. A rigid, board-like abdomen, rapid heartbeat over 100 beats per minute at rest, or confusion and disorientation alongside digestive symptoms are life-threatening emergencies. Schedule an appointment within 48 hours if you have persistent rotten egg smell lasting more than 5 days, unintentional weight loss exceeding 5 pounds in a month, gas patterns that have dramatically changed and stayed different for 2 weeks, or new symptoms appearing after starting medication. When communicating with your doctor, use specific language. Instead of saying, "My stomach hurts," state, "I have sharp, stabbing pain in my lower left abdomen that rates 6 out of 10 and occurs 2 hours after eating." Bring your symptom diary and medication list. Mention the duration. "This started exactly 3 weeks ago," is far more useful than recently. Your doctor will likely order blood tests checking for infection markers, anemia indicating internal bleeding, and inflammatory markers suggesting bowel disease. A stool sample analyzes for parasites, blood, and bacterial imbalances. Abdominal X-rays reveal blockages and abnormal gas patterns. CT scans provide detailed images of your intestines, identifying tumours, hernias, or diverticulitis. Colonoscopy allows direct visualization of your colon lining and biopsy of suspicious areas. Breath tests diagnose SIBO and carbohydrate malabsorption by measuring hydrogen levels after consuming specific sugars. Upper endoscopy examines your esophagus, stomach, and upper intestine if symptoms suggest problems in those areas. Adopt a low FODMAP diet by eliminating high-fermentation foods, onions, garlic, beans, wheat, and certain fruits like apples and pears. Reintroduce them one at a time after 2 weeks to identify your specific triggers. Eat smaller meals 5 times daily instead of 3 large ones. This reduces the workload on your aging digestive system. Chew each bite 20 to 30 times to start digestion in your mouth where it belongs. Drink 64 ounces of water daily, sipping throughout the day rather than gulping large amounts. Avoid carbonated beverages that introduce unnecessary gas. Limit artificial sweeteners like sorbitol and xylitol found in sugar-free products. They cause excessive fermentation in 70% of seniors. Gentle walking for 20 minutes after meals stimulates intestinal movement and prevents gas buildup. Practice abdominal breathing exercises. Lie flat, place your hand on your belly, and breathe deeply so your hand rises. This massages your intestines and promotes gas movement. Yoga poses like knees to chest and gentle spinal twists help release trapped gas safely. Discuss these supplements with your physician. Digestive enzymes containing protease, lipase, and amylase support protein and fat breakdown. Probiotics with lactobacillus and bifidobacterium strains restore healthy gut bacteria after antibiotic use. Peppermint oil capsules relax intestinal muscles and reduce cramping. Vitamin B12 supplements counter deficiencies common in seniors taking acid-reducing medications. You now understand the 4 critical gas types that demand attention. The persistent rotten egg smell, signalling bacterial overgrowth or pancreatic issues, excessive painful gas indicating potential blockages or diverticulitis, sudden frequency changes revealing medication effects or emerging diseases, and gas combined with weight loss, bleeding or fever pointing to serious conditions requiring immediate diagnosis. This knowledge transforms you from a passive patient into an active guardian of your own health. You're no longer dismissing symptoms as just getting old. You recognize warning signs that deserve medical attention. The tracking methods you've learned give you concrete data to share with physicians, leading to faster, more accurate diagnoses. Early detection is your most powerful tool. Caught early, most of these conditions are highly treatable. Remember, your digestive system has served you faithfully for decades. When it sends distress signals through unusual gas patterns, it's not betraying you. It's protecting you by sounding an alarm while there's still time to intervene. Trust those signals. Millions of seniors are living full, active lives after addressing digestive issues that started with symptoms just like yours. You have the information, the monitoring tools, and the power to take decisive action that could add years of healthy, comfortable living to your life. If this information helped you recognize symptoms you've been ignoring or gave you the confidence to seek medical attention, hit that like button right now. Share this video with friends or family members over 60 who need to hear these warning signs. You could literally save someone's life by getting this information into their hands. Subscribe and turn on notifications so you never miss critical health advice designed specifically for seniors. Which of these 4 gas types have you experienced? Drop a comment below sharing your story. Your experience creates a supportive community where others learn they're not alone. If you've already seen a doctor about unusual gas symptoms, tell us what condition was diagnosed. Your insight might be the push someone else needs to finally make that appointment they've been putting off.